Hello. I've seen systems fail vulnerable patients in ways that kept me up at night, but nothing, absolutely nothing compares to what we do to transgender people behind bars. I'm Dr. Dave, a transgender health and hormone specialist, and I've been doing this for nearly 30 years in June. Let me explain something simple. When someone enters jail or prison, they don't stop having a medical condition. A diabetic still needs insulin, a cardiac patient still needs their beta blocker. Those aren't privileges, they are medically necessary treatments. Gender dysphoria is no different. It's recognized as a medical diagnosis, and hormone therapy is evidence-based treatment. And the Eighth Amendment prohibits cruel and unusual punishment. That should settle it. Unfortunately, it doesn't. Here's what actually happens. A trans woman, someone who has been on estrogen therapy even for their entire life, enters custody. Her hormones are stopped. They're not tapered, they're just stopped. We would never do that to a postmenopausal woman. We would never do that to a man on testosterone after an orchiectomy. But what we do here is because the system treats her medical needs like a behavior instead of a condition, and the consequences are not subtle. This isn't going back to baseline. Her body has adapted. When you abruptly withdraw hormones, you can trigger severe depression, anxiety, acute dysphoria, and suicidal thoughts. We are inducing a medical crisis, and we're calling it intake. And then there's housing. Most facilities assign people based on sex at birth. So trans women are placed in men's facilities where rates of sexual assaults are dramatically higher. There's a law, the Prison Rape Elimination Act, meant to protect them. It is not consistently enforced. So what's the alternative? Protective custody, which is basically solitary confinement. 23 hours a day alone. We know what that does to the human brain. So the choices become risk sexual assault or accept isolation that causes psychological harm. That is not protection. That is punishment with even extra steps thrown in. Now, to be fair, some courts have recognized this. There have been rulings that denying hormone therapy is deliberate indifference to serious medical need. Some systems have improved, but enforcement is inconsistent, and while policies get debated, real people are suffering right now. So if you're a clinician watching this, please listen. Your documentation matters. A clear, well-written medical record establishing necessity can protect your patients legally. Your letter might be the difference between treatment and withdrawal. And for everyone else, this doesn't happen in a vacuum. Trans people are incarcerated for the same reason everyone else is, or anyone else is: poverty, untreated mental health conditions, simple survival. And trans women of color are disproportionately targeted at every step along the way. We fail people on the outside, and then we fail them again when the full power of the state is involved. This correctional system is a mirror. It shows us exactly how much we value the people we claim to protect. I've been doing this for 30 years, and I'm not going to stop saying it until it changes. So I'll ask you, what really is stopping reform? Policy, funding, or political will? I think in the current context, it's political will. But let me know. I always read everyone's comments, and I try to respond as long as you're not threatening me. As always, let's remember to love, support, and protect each other. I'll see you soon.